Bonnie, so what case are you going to present for us today?
We're going to discuss a 3-day-old foal that presented. It was weak after it was born.
And how often do you utilize SAA in your evaluation of weak neonates, and what does an increase in your SAA in these cases signify to you?
When I'm presented with a weak foal such as this, my typical, first diagnostics is a good physical examination, and then we do blood work, including an SAA. If I see an increased SAA, then I am more suspicious that we have an infectious process going on. That said, though, some foals, in the cases this foal, it was weak, but it had a 0 SAA, and so that made me, treatment continued. We started our treatment, our typical course of antibiotics and prophylactic antibiotics, and then just supportive treatment, and then continued to monitor and follow along the SAA values.
And if your SAA was 0 to begin with and you've instituted antibiotic therapy, what are you looking for when you're monitoring over the next few days?
What I'm looking for is a rise in that SAA, and I'm also looking for is the foal clinically, improving. In this case, the foal over the next couple of days started to get stronger, is able to get up and down on its own. But then when I repeated an SAA, it increased. It increased up to 31, and just because of the history of the foal coming in weak, I went ahead and we did some further diagnostics, and we pulled out the ultrasound and did an ultrasound of the chest and of the abdomen, and all that was normal, so we just continued and stayed on our course of treatment.
And it's been my experience that neonates typically do not exhibit a significant of an increase in their SAA response when compared to adult horses. So what sort of values are you looking at that might indicate that you're dealing with a foal that's potentially septic?
What I'm looking at in these foals, at least in my hands, if it's a weak foal that comes in, I'm looking at the SAA value. If that SAA value initially is over 100, then I'm concerned that there is a septic process going on. And some of these weak foals that come in, they, like this one, it could be 0, and that could indicate to me that it's just maybe more of a little bit of a weak foal, maybe a dummy foal, but I'm still closely monitoring that foal, treating that foal, and closely monitoring that foal for any changes in clinical signs and SAA values.
And as you go along the course of treatment, are there any pitfalls that you're looking for that your SAA might might shed some light as to whether or not they're impending or around the corner? Any complications that you might be looking for that your SAA might point you towards?
I think, especially in these weak foals, one problem that we see, secondary problem, is pneumonia with these guys, and oftentimes, that's what the SAA will start creeping up, and so, for instance, for this foal, it went up to 31, and I went ahead, and that was the first area I listened to the lungs very well, and we ultrasounded the chest to see if there was any changes on the lungs.
And there are a lot of external factors that can obviously influence the SAA.
Yes.
And in most of these foals that are compromised, we end up giving them plasma transfusions. How does a plasma transfusion potentially impact your SAA? And how do you typically interpret the SAA post-transfusion?
I think with a foal that's had a plasma transfusion, you have to kind of cautiously interpret your SAA, especially those products that are hyperimmunized. Oftentimes for a day or two, you will see a rise of the SAA, and that can be confusing because that foal can clinically be improving, and yet you have this rise in the SAA. So I think you need to take that into consideration when you're kind of evaluating how the foal's doing.
Great. Thanks, Bonnie.
You're welcome, Rodney.